Pharmacy Times. Everything pharmacy, every day.
Critically important that healthcare workers remain up to date on COVID-19 vaccinations, including the most up-to-date boosters and with their flu shots, because healthcare workers are on the front lines of caring for our most vulnerable patients. Unfortunately, recent data shows shockingly low COVID-19 booster uptake amongst this critical group, my own colleagues. We know that healthcare workers recognize COVID-19 is a serious health threat, but they've also expressed low confidence, I think, in the vaccine's effectiveness, safety, and benefits. And in that way, they're not unlike the general public. A couple of things lead into this specifically for healthcare workers. I think, first of all, there's complacency and pandemic fatigue. So you've got to remember that healthcare workers typically have already received multiple doses of the vaccine. And because they're healthcare workers, they've also, in many cases, been infected multiple times. So there's a complacency, I think, that healthcare workers are even more predisposed to have. There's misinformation and confusion. And again, that's for healthcare workers and the general public about efficacy, the need for boosters, and about safety, particularly for populations like young males or for women who are of childbearing age. There's a lack of trust in recommendations. We have to acknowledge that the CDC and others have confused people with constantly changing and evolving vaccine guidance. And there's workplace culture and peer influence. And I've seen this happen in my own hospital. I still practice clinically, and in many cases, if one person is expressing doubt or saying I'm not getting it, then there's that peer pressure to conform. Accessibility and convenience, I think, are key. And this may not be intuitive to folks because we're around healthcare systems all the time, but logistical issues may still pose a barrier. So we have flu clinics at my own hospital, but we haven't had a COVID-19 booster clinic at my hospital. And in order for me to get my booster, I have to take time off work or find personal time, which can be hard to come by for healthcare workers. So those are just some of the concerns. I think another important thing to consider is that many healthcare workers, again, like much of the public, falsely see themselves at low risk. You've got younger people, in particular, when you think about pharmacists, nurses, doctors, and they don't see themselves as being in that high risk category for bad outcomes if they get COVID. I think it's important that we have tailored messaging addressing specific concerns that healthcare workers have. We need to have clear communication of the benefits of the booster shot, not just for personal protection, but because we have an obligation to protect patients. Many different employers have experimented with incentives and recognition, public recognition for people who've gotten their vaccinations, and peer-led campaigns. Not just do it because the CDC says, but using colleagues and peers as example, showing that your colleague or someone who you look up to got it, and so you should get it too. As I mentioned, there are logistical barriers, so having workplace vaccination clinics can help increase uptake, and we need our leaders to lead by example. So having hospital leadership publicly getting their COVID and flu vaccines, I think, will help other people understand the importance of getting them, again, as I mentioned, not just for yourself, but because we have an obligation to protect our patients.